Earlier this week, we covered a story about Minnesotans' views on racism as it relates to what health experts call a public health crisis in this state. Results show that 42% of Minnesotans say racism is not a significant problem. We've been focusing so much, especially this week, on Black and brown Americans with the death of George Floyd and now with the trial of the man accused of killing him, Derek Chauvin, about to start on Monday. Racism within the African American community has also taken center stage because of it. We're changing the focus somewhat on this today. ABC News is putting out a special tonight on the racist and violent attacks on Asian Americans due to the blaming game of this pandemic. The coronavirus has been linked to an uptick in attacks against Asians in this country over the past year. A national advocacy group just put out this week that they've received almost 3,000 reported incidents of aggression, specifically targeting Asian Americans, just between the months of March and December of last year. What's even more disturbing is that those who have been targeted within this community are the elderly and women. Vajang Mwao is the Director of Health Equity and Advocacy for Blue Cross and Blue Shield of Minnesota. And that's where we received the Minnesota study from on racism earlier this week. Vajang, thank you first of all for agreeing to talk to me about this, not just racism in Minnesota, but this particular or specific population group. A growing body of research suggests that experiencing such racist aggression definitely has serious mental health impacts. I think that goes without saying. But let's start there, Vajang, and how big of an issue this is in Minnesota.
Oh, this is a tremendous issue, Betsy. This issue has preceded COVID-19. This issue has preceded the murder of George Floyd. And I just want to come out from the beginning to express solidarity with the African American community and to tie the anti-Asian racism that is occurring across the country and across the state to what I think is the root cause, which is white supremacy. And so I want to make sure that all of the anti-racism efforts are seen as connected and in solidarity.
I cannot stand seeing hate against any group, and I think most normal Americans would agree with that and say that they don't like to see it either. Because I don't see it, and when I do, it's in the news. Talk to me specifically about those within the Asian communities throughout Minnesota, what you've heard from them.
Yeah, you know, our community's been dealing with multiple public health crises for quite a while. We have the pandemic, COVID-19 affecting and afflicting our communities, and overlaid with that, we have the racism that is attached to that, the mental and physical toll that has taken place because of the framing, the racist rhetoric around COVID-19. And I just want to be very clear here, Betsy, that these public health crises compound each other, right? And so when you have pre-existing health inequities in diabetes, in chronic disease, in mental health, and then overlaid with the pandemic or COVID-19, and that's not only the infection inequities and infection in mortality and in COVID vaccination, it's the inequities in dealing with physical and verbal harassments, whether that's in grocery stores or going on a walk in the neighborhood, that all of these have a compound impact because we're dealing with both the mental and physical aspects of racism, as well as the mental and physical aspects of COVID-19.
There's also a problem with getting people who have been the victim of, especially if somebody just says something to you that's not necessarily going to be reported. But if there's violence, you know, if somebody comes up to me and shoves me purposely or punches me, I'm going to report it to, you know, I'm going to call 911 right then and there. But that's not happening with these instances. Why is that?
Yeah, well, I think there is some very legitimate distrust of the government. And that's not to say that the government hasn't made progress in understanding, diagnosing, and documenting these incidences. But I think we do need to make sure that we're investigating and hear not only crimes, but racial and hate incidents, harassments, so that we can follow up and get a better read on what is actually happening. There's also great distrust in just whether there'll be follow through and whether there'll be a due diligence in hearing of the actual incident.
Bajang, let me ask you this. If somebody says something okay, let's say I'm in the grocery store, I'll give you an example, and I'm next to another customer, and I hear someone out of the blue say to that customer who's Asian, some kind of disparaging remark, or call them a name and then just walk past them. Because that's not necessarily a crime, it's wrong on all levels, who would I call to report it? And, because my first instinct would be to show compassion to that person who's standing next to me and just say, I am so sorry that that person just said that. But what's my next course of action?
Yeah, I think our Department of Human Rights has really transformed the way it listens and engages with our communities, and I give Commissioner Lucero all the props in the world for really building racial equity into the agency. So there is a 1-800 number, a helpline to call if you experience or witness an incident like this. But I also want to be very clear, Betsy, that if it's a physical violent act that you are witnessing or participating in, that you should call 911. Yeah. Okay. There's a difference between reporting a racial slur or to be told to go back to your country versus a very physical and violent act.
Bajang, if I can get you to hang with me just 2 minutes, I'm going to take a break and we're going to come back and talk about how this has gotten to the point of where it has. Because 2 years ago, 10 years ago, maybe it wasn't the problem that it is today. I want to talk about a little bit of the politics of this. Give me just 2 minutes and we'll be back and talk about that. I'm continuing my conversation now with Bajang Mua, who is the Director of Health Equity Advocacy for Blue Cross and Blue Shield of Minnesota, because earlier this week we were talking about a survey that came out through Blue Cross and other organizations about how 40-some% of Minnesotans don't believe that there is racism in this state. That is not the case, and we have seen over the last year with the death of George Floyd, racial issues becoming much more highlighted in the news, talked about, and whatnot. And while it's great that we're exposing the problem, trying to figure out solutions to the problem, I wanted to speak with you specifically because of the politics of the pandemic and the Asian community that has been targeted with crimes and, people saying just horrible things to our Asian Americans. So the politics behind this, get people to understand that Bajang, I'm not trying to blame President Trump, but anybody who continues to perpetuate that this is the China flu perpetuates that sense of racism.
Yeah, absolutely. Regardless of the party or the person, anyone who's calling this a Chinese flu or Kung flu is exasperating the problem and is building upon this misconception that Asian Americans are the constant foreigner, right? And that we are a scapegoat for the pandemic. And so that kind of rhetoric is certainly inflammatory and exasperating the problem. I will say, Betsy, that this problem has existed before the Trump administration, before COVID-19. And the political spotlight and illumination is lagging behind what communities are experiencing in terms of racism. And so I just want to make sure we have a historical context that the first immigration policy in the United States was the Chinese exclusion, right? We have the Japanese incarceration camps. And so there's a long history here that is starting to accumulate in the public consciousness. And so I just want to make sure that although the previous administration had inflammatory remarks and policies, this belongs to a groundswell of rhetoric and political opposition to Asian Americans and to which has been grounded in a history and contemporary atmosphere of racism.
I'm glad that you mentioned that, because I don't see that. Because I don't walk in your shoes, I don't see it, I don't experience it. As you say that this was before the pandemic even started, I have a hard time wrapping my brain around that. And I think there are other white women or men like myself who, because they don't see it, they don't experience it, think that it doesn't exist.
Betsy, when my family arrived here in 1976, we were the first Hmong family in Eau Claire, Wisconsin. And my mother expected a welcoming party. And the first thing that our Lutheran church told us was, please don't worry if people mistaking you for Korean or Japanese. There's still hard feelings about the Korean War and World War II, and obviously the Vietnam War. And so on arrival, we were already forewarned about discrimination and racism and being mistaken for the enemy. And so I just want to give you that, so you understood how pervasive and ongoing this has been.
Yeah, deep-rooted. Let me tell you that as a child in the late 70s, my family took in refugees, and through our church we helped so many Hmong refugees in the community by Winona, Minnesota. It's not far from Eau Claire. And so that's why I have a hard time understanding the hate, because I didn't grow up around it. And so as you talk about it, and as we talk about it, I'm sad. I'm just so sad, because I hate to even think that it exists, but it is there.
Yeah, and Betsy, I just want to call out this like colorblind spot in the Minnesota
Midwest.
Yeah, in the Midwest, but definitely here in Minnesota too. And I think we're in an era where racism isn't just about implicit bias or stealthily built into policies and systems. It is very overt, very direct, very physical and violent. So we've always had to deal with the undercurrents of racism. But what I think COVID-19 and this political atmosphere has done is to actually create political capital on being openly racist. It has given permission and validation to otherize people who are not white, and to point fingers at Asian Americans for being the cause and the source of this pandemic.
Well, personally, I think you are a fantastic individual. I have such high respect for you, the position that you're in with the career that you're in, and the fact that you took some time to talk about this specifically was very enlightening for me. Bajong, thank you.